Hi everybody, my name is Karina Medina and today we'll be talking about chlamydia in young adults in the United States. To start off, let's talk about what is chlamydia. According to the CDC, chlamydia is a sexually transmitted disease caused by infection. It can be transferred through vaginal, oral sex, or anal sex. It can be cured with proper medical attention and treatment. Usually there are no signs and symptoms when it comes to chlamydia, but if they are, they may include rectal pain, smelly discharge, burning when peeing, sore, and bleeding. Why is this a public health issue? This is a public health issue because chlamydia can be spread from person to person within the same community and can also be spread from community to community. For examples, cities, schools, etc. Chlamydia can also cause major health issues in the female and the male body if it goes untreated. We will talk about that later in the slides. Let's talk about who is at higher risk of contracting chlamydia. According to the CDC, chlamydia is the most contracted sexually transmitted disease in the United States. There were about 4 million chlamydia infections in 2018. Chlamydia is the most common in young adults between the ages of 15 and 24. About 1 in 20 sexually active young women aged 14 to 24 years have chlamydia. Let's talk about what happens if chlamydia goes untreated. In females, according to the CDC, untreated chlamydia can cause pelvic inflammatory disease. Can also cause formation of scar tissue that blocks fallopian tubes, ectopic pregnancy, infertility, long-term pelvic and abdominal pain, and just like HIV, chlamydia can also be passed on to infant during childbirth if the childbirth is vaginal. For males, it's a little different. According to the CDC, men rarely have health problems when it comes to chlamydia, but it still is very possible. The infection can cause a fever and pain to the tubes attached to the testicles, and in rare cases, it can lead to infertility. So it is very important for a sexually active person to get treated for chlamydia and get tested every 6 months or after every sexual partner. What can be done to help prevent chlamydia? These are personal suggestions of mine. My first suggestion is schools should provide sexual education in all 50 states. As of right now, only 29 states reinforce sexual education. My second suggestion would be all schools should provide STD tests for sexually active students. My logic behind this one is I believe teens will feel more comfortable getting an STD test without a parent or guardian around. I believe it will motivate them to get STD tested on a regular basis. And my third reason would be abstinence. And then my last slide is just my references. Thank you for listening.